Yeah, I have 2 seconds. I can show her real quick. Because I'm waiting for Josie to get on the table, too. That's going to work for your office, too, to do it that way. I know. It's very simple to do. Start about 2 minutes. Just make sure it stays on. That's it. Okay. Back in 2 minutes. Hold on.
Serious pressure for you now, huh? It's on.
Right here, Josephine. And then there. Chris?
We'll do it next week. She won't be here next week.
All right, here. Chris will be right behind you.
I know. That's what I'm saying.
Right there, sir. Actually, I'm gonna put Sean over here. He's a little. Actually, I'm gonna put you over there, and then Sean over here. All right. We good?
Thanks, yeah.
All right, we're good. Actually, you're good right there. We'll get started.
Yes.
There's like a fire hazard now, so don't call it fire marshal. What's Tangerine?
Thank you.
I do.
I figured. Got it. Here. You have a pen too, Dylan? Are you
Here, you
serious?
can use my pen because I can't write right
Okay.
now anymore.
Perfect.
Who wants it? Who
There
needs
you
it?
go. Right here. One, okay. Good job.
Thank
You're the
you.
writer today. Get
It's
stuff
literally
started.
my pen, so I'll need that back.
That's right. I'll give you a pencil. Don't feel bad if that pen gets lost in the mail. So Chris,
Oh,
we
sweet.
got that UCLA Bruin pen.
Oh, yeah.
Back over there.
If I leave early, I know I don't want you to lose it.
Got it. Get started. Get you guys home in a bit. Okay. The big thing we want to do tonight is make sure you understand. We treat the back, we treat the bones, we move the bones to make sure the nerves work better. That's the key. The nerves control everything in your body. If the nerve gets cut off, we die. Okay? That's how the body works. We want to make sure you're not becoming irritated, those nerves stay healthy. We'll go over what that is in a minute. Okay? First we'll talk about here at the very top of your paper. Everyone has this one. Our purpose today. Chiropractic philosophy is a shift from patient perspective to chiropractic care. This includes treatment of the back and neck, obviously, is what you're here for. But all the wellness of the body. The wellness of the body includes good nutrition, exercise, maintaining a healthy nervous system. I require stretching and exercise with my patients because it moves things around so your overall body chemistry, hormonal levels, and nerves can work at a better level. That's what I want people to realize. So by doing those, and this is the end part of the talk too, you maintain good habits so I don't have to see you. Obviously I'm busy as it is. It causes fires as it in here today. Okay? But I want to make sure as you get through this care and you feel better, what do you do next? I want to hear from you, what else can I do? What else should I be doing? That tells me you have the mindset, I'm getting better, I'm less anxious about working out or staying strong, and I get to the next level of living my overall care. That's the big picture. Okay? The next part is, we want to talk about how the nerves form and how the body works. Thank you, Taylor. Have good nights. And how things work overall. As we all probably studied somewhat, I think now they talk in junior high where the birds and bees, how they work, right? Okay. Sperm and egg come together, they form a union. After about 7 days of fertilization of the overall egg, the body starts moving around, developing in different tissues, separating. So here, kind of low, we'll work with this. It's called a primitive node. Okay? That's the first thing when the egg forms together, is here. Primitive node and primitive streak. In the human body, what do you think this is after birth? There's a question and answer today, people, so make sure we're awake. The vertebrae, not yet.
Yeah.
What's inside the vertebrae? It's spinal cord. Spinal cord and brain. Okay, the first things to form in the human body. That's your core, and from everything else branches off. Okay, from there, this nerve from the brain will track down through the spinal cord, down to the opposite upper part of the body, and down to the lower part of the body on the same side. So the spinal alignment tract, don't worry about it, there's no quiz afterwards. I remember that all the time, so I seem knowledgeable, right? I seem intelligent sometimes. Okay? Same thing on the other side of the body. It goes from left side of the brain, right side upper body, and down here, same side. So when it has a stroke, it's exactly what happens to the body. Okay? Realize those nerves, even though the stroke may be in the artery in the neck or the head circle, what's called the head, the arteries in the head, that affects everything down beyond that too. So realize everything's connected. Once those nerves form to control and wire the whole body, we form organs. See the heart in the middle there? Let's do a spleen. Let's do a couple kidneys down here. Okay, any questions so far? You guys impressed with my artistic skills, obviously. I hope not. Okay, once they form the organs, the next step is how to protect the actual brain spinal cord. You want to make sure, like Chris had mentioned earlier, putting that spinal column, those bones in play to allow load when we sit and stand, but also we allow a shield so our base for our body, our nerves can actually sit there and protect itself. Even the brain too, has a shield, the actual skull itself. We want to make sure our body, once the body forms and develops in the uterus, at that point we want things to make sure you come out and protect itself too. The body has inside computer it works with, everything works together. Okay, so I don't use arms or hands, use sea turtle fins, whatever you want to call them. Right. Any questions so far? This is pre-birth, so once these organs and things form, they interact and wiring system of the body gets things to come out and be birthed normal. I'm not going to walk through a natural birthing because that'd be weird. Watch National Geographic if you want to. Any questions about this? So the reasons I draw that, these nerves, I'm going to blow this up in a second, they control down the arm, right? Down the leg, people have some of those issues, even causing headaches too. Once we erase this, it's gone forever, thank God. We're going to talk about how the nerves are affected when it's abnormal. Second part of your paper, that first page, talks about what's called the subluxation. This is what happens to the effect of the nerve being pinched in that area, and that dysfunction. That nerve, that job of the nerve is to make that, from the brain to the spinal cord to the body, make that nerve function normal. What normal means, and if you have studied sine waves or tangent or things like that, how the nerve can actually flow, this is normal nerve flow, a normal sine wave. Okay? High and low, normal velocity, so talk about voltage, electricity, normal voltage for a nerve. At that point, if that nerve from the brain to the body is working normally, will the muscle stay relaxed or in pain? Relaxed. Okay? Strong. That joint will stay loose. That organ will stay relaxed too. The overall body feels relaxed, healthy, and strong, and recharged. Okay? If nerve gets irritated for some reason, pins being pinched at the actual spine, can go haywire and have too high of an amplitude and too low also to go below what it can handle and cause become stressed. When that happens, what's going to happen to a muscle? Go into spasm, causing sharp pain. Even numbness to other issues of the nerves. Over time, if that stays that way for a period of time, or becomes more severe, the body's intelligent, it doesn't want this to happen. It can cause overall permanent damage to the body. So what it'll do is cause this to happen in that nerve to start shutting it down. So instead of a normal amplitude, high amplitude, that's low nerve flow. At that point, the muscle goes from pain, sharp pain, to weakness. That's why I ask the questions in the examination, not because I want to be intelligent, but I want to know what stage are you in when you come into the office. Are you here, here, here? Is it causing arm pain, leg pain, or leg weakness, hard to walk? How hard to hold something in your hand? So I want to see exactly where you are. That point dictate how far to get back from here, one of these, back to better normal. So you get there and stay there. That's the plan. Any questions so far? Bottom of the first paper again. Subluxation, that big word. Sub meaning less, lux meaning light, ation meaning something in, I guess, important, I don't know. Complex of something. Okay. That means that our job is to make sure that light stays normal, doesn't become too bright or too dimmed. This is more of something that was kind of developed or philosophy back in the 30s. So they used a vibration tool to test the vibration of the nerves back then. Even the light source, so they didn't have technology we have now. They use that, so they use that as a source to kind of tell what's going on. This word means when it goes from the brain to the body, how it affects that. So our job is to remove the subluxation, so the effect is gone, so the body gets back to function normally again. That's all it means. Getting back to normal function. That's what it comes down to, right? Normal not meaning that we're not taking medications. Normal meaning that we can get off the couch. Normal meaning that you're back to a normal, healthy life, strong, flexible, and feel and stay good. That's our normal. Not medical normal where it's just, okay, you're out of pain, don't figure the rest out. Our job is to want you strong again so the pain doesn't come back. You can tolerate more and do more. Back to a better normal life. You can exercise before, do things, so your body can stay that way. Any questions about that? It's my little soapbox. I'll have another soapbox in a minute too. Okay. Second part here, you have this paper. Right? Right, everyone? And this paper. They work together. This is a nerve chart, how the nerves work. Okay? Chart of effects of spinal hemisphere. See the YouTube video, get this in the box too. It's in there. Look at it and see. But this walks through how the nerve works properly. So, with this one paper, have your spine have the location of what organ or muscle or joint it affects, the middle. The last column is your symptoms or conditions. Okay, how it affects when the nerve becomes improperly functional. This is not chiropractic drawn hoopla. This is a science-based book called Gray's Anatomy. That's the Bible for anyone studying medicine or human physiology or anything. They have like, I think 82 editions now. We have like the 34th edition. But a lot of it is the body is the same body. How we study it is based on the same information as medical doctors do, or physical therapists, or surgeons. This is just from that information, okay? Using this form now, going back to a second, I'm confuse you guys. This paper here, okay? This is what happens with the body once we're birthed. I'm not gonna walk through that process because you guys can figure that part out. Once we're born, how can we affect our body to cause nerve injury or nerve problems that can affect our overall health? First part is exercise. Okay? Exercise, and again, apologize for the penmanship. How it'll work. Exercise, an expression of muscle control just by definition. If we use this form, go down to C6, so C1, 2, 3, 4, after 5 to 6 on that paper. The location of that is going to be neck muscles, shoulders, and tonsils, right? Okay. Go to the far right, it causes what? Stiff neck, pain in the upper back, or upper arm, tonsillitis, whooping cough, and croup. It's like whooping cough, I guess. I don't know. You're asking me things beyond my knowledge. Okay. That's the stuff as we worry about. When that's affected, everything here on this beautiful chart built in 1979, it's still, again, human physiology, that area there affects everything there in the neck. As you come further down, affects everything here around the glands, around the mouth. All right? So the same nerve that comes down the back affects part of the other organs too. It's a miracle. It's amazing. Blows your mind, right? Right? So there's emoji, blow your mind, I think, or something, right? Sylvia? Possibly? I don't know. Okay. So we want to make sure we understand when I talk to someone about their problem, say in this situation, upper back pain, ask them what else is being affected. What other part of your quality of life, and this would be a vague perspective, is being affected by the nerves in the overall neck in this example. Okay? Other part in that paper where it says exercise, go down to the last one in that first section, exercise, subluxation of the L4 effects on the back, aches, and sciatica. So we go down here to L4 on your paper, your little map area, which affects the prostate, muscle of the lower back, and sciatic nerve. Far right, sciatica, lumbalgia, which is basically generalized back pain. I looked at that one up. Difficult, painful, or too frequent urination, and backaches. Okay? Does that make sense? How to affect urination? People are like, no idea, right? Okay? I had a patient come in about probably 3 years ago now, 24, 25 years old, young kid, in my sense I'm 43, and he had severe back pain. X-rays were bad. But the biggest thing I sent him to the hospital for, emergency room, because he hadn't gotten urinated in 3 days. When you have back pain, I see I'm blowing your mind right now, those nerves that cause sciatica down the leg, from the lower back, affect the lower intestines, the prostate, and also the bladder. Crazy, right? So these nerves affect muscles, what you feel, sometimes organs, what you don't feel, until they become a major issue. So you want to make sure your body's functioning normally, the overall body's functioning normal, not just your muscles. Any questions so far? Crazy, right? Crazy. Crazy, Mike? It's cool. Yeah? Well, good. I like cool. I like cool and crazy at the same time. Like a crazy bachelor party or something. I don't know. Next part here is diet. Okay? Number 2, the effects of your health. So diet, you have problems with our nerves, can affect your ability to absorb nutrition and also lose weight. So part of this diet, subluxation at T6. So again, go down your form, T6. Mine is like a cheat sheet. Middle there. Affects your stomach. stomach trouble, including nervousness, digestion, heartburn, dyspepsia. A lot of studies now talk about your stomach being your second brain, and how if your brain, being your stomach in that sense, to function normally, affects your hormones, affects your body chemistry. So that can cause chemical hormonal reactions where you cause other issues in your body too. So realize having things working proper digestion-wise with diet, with how the nerves work with your stomach, keeps your overall body healthy. So in this sense, if someone has upper back pain, say T6 again, let's go right here, in those areas, affect those same areas in the areas around the ribs, cause the problems that happen, the overall stomach can be affected. Crazy. All right, so for people that hunch forward a lot, get that because your ribs pop out, causing not only that problem back there, I think it's on this sheet, but here too, where that same rib area can cause arm pain and/or problems that go down to the heart area, causing heart issues too. People come in probably about 4 so far, where they have chest pain, cardiogram's negative. Cardiologist says it's negative. It's stress from the back causing come to the front. So we want to make sure we treat the overall body, so realize where their body is as a health perspective, not just one area or 2 areas. How the overall body either getting better in health or getting worse in health. Next one is sleep. Crazy. Okay. When our body's under stress, do we sleep less?
Yes.
Yes, right? And everyone said yes. Okay. What causes that to happen in the structure is right up here. C1, C2 area, causing headaches and neck pain. And at the very top, the occiput, where it affects the whole overall body. So going backwards from this chart to your paper, to your chart, to your map, C1, the very top one, you can't miss it. Tons of blood supply of the head, pituitary gland, scalp, bones of the face, brain, blah, blah, blah. Inner ear, middle ear, causing sometimes ringing the ear for 1, 2. Sympathetic nervous system. You know what that is? Sympathetic nervous system. I'm going to go over it. Anyone have an idea what it is? This is my main thing of what we want to talk about. I'll leave that up there. Sympathetic. Let's have sleep. Sympathetic. Okay. That is your stress response to the body. That is if you're being chased by a tiger, you want that to kick in. You want to go, I got to get out of here. Okay. You want your heart rate to increase, blood go to your external organs, your muscles, feet, legs, whatever it is too. Heart rate increase automatically, like seeing a scary movie, so you get out of there. That's the plan. Short term, good thing. Long term, it makes your body overall stay under stress, so everything here wants to stay there where you have the heart palpitations for no reason at all. You have the headaches, you have everything in the organs from 1 and 2, including the bladder, intestines, just doesn't feel right. Any questions about it? So our job, if you move the bones properly, get these nerves to calm down, it goes from a stress state where it affects, increases stress hormones. I won't go over the name because they're confusing sometimes. And also, under stress, increases your body chemistry and neurology too. Where our job is to decrease that over time, we go from sympathetic to parasympathetic. Which is your rest and relaxation. That's your balancing point. Okay? It's hard to see from back there, unless you're silly because you have cool glasses on. Every organ here has a blue and a green nerve. That connects what's called your autonomic system, your automatic system, which is your heart rate and your breathing, happens automatically. Everything comes back to your brain, and from your brain back to your organs again. So if our job is to make sure we calm down the nerves as chiropractors, those nerves that go back from the organs to the brain telling there's under stress, those will calm down, get things balanced out so your parasympathetic and sympathetic have a better balance, tolerate more stress. If your body comes in and you're under stress, even physically, you're overbalanced on that sympathetic side. You want these areas, if you're overbalanced here, to decrease. So over time, this decreases, this increases, so overall body can get back to a better state nerve-wise, and then from there your organs and your muscles and your joints function to be more relaxed. Any questions about that? That's the big picture. If we get this to increase by calming down this, that's how we do it. We do that by causing increasing joint motion. Okay. In the spine, you have receptors that affect that when these nerves come back from the organs to the spine, go back to the brain. By having that nerve flow being even, that allows things to calm down faster. Outside joints, yes, but the nerve flow occurs mostly through the spine, so you want all that moving properly. At that point, your body can readjust quickly, and then once you feel balanced, and then you can increase stress to your body and stay in the parasympathetic system. How would you increase stress from a health perspective? Healthfully? I don't know. How would you increase stress in a good sense? Exercise. What else?
Sex.
Yes. What else? Mental. We talked about the music too, right? Playing music. Anything to distract your body. People, I did an interview for a podcast with Monica from Music Tree in Pomona. People go there just to de-stress their body by going and playing the drums, learning guitar, playing guitar. People do that as a form of stress relief. Whatever works for you, if you move your body, at that point you maintain this increase, you can tolerate more stress, meaning you can go and work a more exciting job. You can drive to LA every day for work. Bless you if you do that. Okay? You can work longer hours, have more time with your kids and family, sleep less, but not have the effect of your body causing not only tissue pain, but also organ dysfunction. Does that make sense? That's why I want you stronger, more flexible, doing more things so you feel the result of your nerves calming down by the structure maintaining the motion in your spine, so at that point things work better, can tolerate more of the stressors in our environment. Everyone said amen?
Amen.
Amen, right? That's how we do. I want you moving more. Medically, you would be told what? Stay home, take medication. Be careful what you do. Don't work out because it'll make it worse. Our job is to get you there where we can get there and stay there. Only lifting more weights. I want you feeling that parasympathetic response to the nerves, so you get that hormone release of good hormones, so you can tolerate more stress and do more of what you want to do. And or get back to your normal lifestyle you had before the injury and stay there. All right. Any questions at all? That's really my soapbox. That's what I do. Okay. The last couple parts here are kind of just to kind of give you more of the bigger picture. Any questions about this knowledge? We're like at least $5 or something. Here, the last two. One is called PMA. You know what PMA stands for? Well, it's one of those old sayings, it's classic sayings from like the 1800s or early 1900s. PMA. What's that mean? Not PMS. We'll use that forever. Positive mental attitude. Without that, without a little bit of it coming in, you wouldn't want to actually listen to me. You want hope. We give you hope. At that point, you maintain this, and the nerves help you do that too, right? If you feel better, you just feel better. At that point, you maintain that need and that attitude by keeping yourself active and strong. That way, these hormones function to make sure that attitude stays healthy. When you're under stress a lot, it'll cause anxiety. You'll feel anxiety from that. Our job is to make sure you maintain an attitude by doing things that works for you, music, dancing, exercise, whatever it is too, so you keep that attitude strong. Okay, last one here. I think the most important part, but that's just my bias. HNS. What does that mean? What do you think, Chris?
Healthy nervous system.
Yes. Someone saw my previous talk. Someone saw my previous talk. This controls everything up here, right? Talk about all that. We want our overall body working better. These nerves working better, so your overall body can function better. And again, tolerate more stress. Any questions at all? Joe, Mike, Joe. Anything? What about this? And I have this. Anything like that? Hmm? Does this make sense to you? That's why I push the exercise. That's why I give you the stretches as emails so you can start doing them and feel that difference. I had a patient probably 3 years ago, Rachel, came in, 64 years old, in a walker, just looked old, right? And I'm in a lot of leg pain, back pain. Can you help me? I'm like, I don't know. Take the x-rays. X-rays look good. Go, Rachel, x-rays are good. What's wrong? My doctor said a year ago not to move, so I stopped moving and went from sitting in a chair to a cane and to a walker now. But it's still weak and sore. So our job was to get her away from that because her back was good. It wasn't great, but it was movable, potential there. Rachel, your back's fine, start walking. But my doctor said, I don't care what your doctor said. So she went from a walker down the street, around the block with her daughter. She went from that to a cane around the block. Now she walks 45 minutes a day on her own, no cane, no walker. But took her time to get through the pain where she can go, okay, I have a problem, I can get it better through the pain so you get herself healthy over time. It's going to be sore sometimes, it's going to be painful. Can we get through there? Yes, when you know there's not causing more of an injury. And so the exercises we take back there help us prevent future injuries by knowing what's going on inside the body. So you find whatever works for you, but you get yourself where, okay, I'm going through some pain right now, what else can I get myself stronger once I feel better? Even more flexible too. And maintain that routine. Actually, I gave you other ones too, so you maintain that so I don't have to see you. It's my plan. Too busy as it is, as you can tell. All right. Any questions at all? Anything? That's all I have for you. If you borrowed a pencil, give it back. Don't be a thief or a pen. Knock it out of here. You want to turn it off, Mike? There's a button on the right-hand side, upper right-hand corner, I think, is the off button.
It's like an
Thanks
X.
for watching. Anything? Good?